Members of the group are coming on, and can everyone hear me well? I am going to go ahead and get started. If you could please, I'm going to go ahead and start answering some of the questions that were left in the comments section last time, and so that I can go ahead and address any questions, concerns that anyone may have and help better understand how I, as a plastic surgeon board certified by the ASPS Society, understand this phenomenon of breast implant illness. So one of the questions that I was asked, are saline implants safe, or is it just the textured implants that cause the problem? And from my experience of having managed a lot of patients and ever since being in the world of surgery since 2003, the saline implants are as bad as the silicone ones, and they cause the same types of breast implant illness signs, symptoms that the patients present with, and these are very involved and very serious. The same suicidal thoughts, for example, rashes, joint problems, cognitive dysfunction, memory loss, amongst all the sign symptoms that we know of what breast implant illness is. So to answer that question, breast implant illness is certainly caused by the saline implants, because the silicone shell is what is notorious and the causative agent behind the implant illness. And this is why the body reacts to it, even though it's a small amount of silicone. And we know that these silicone implants are very much intact, because, as we know, if the silicone implants rupture, they're going to essentially deflate like a water balloon, and you're going to see that the patient's chest is essentially going to be flat on the side that the implant has ruptured. So I give the analogy that if someone smokes a cigar, it doesn't have a filter, it's very strong nicotine, versus another cigarette that has a filter. It's not that it's safer or it's safe to smoke a cigarette with a filter. Both or all of these agents are certainly cancer-causing agents, and all of them are proven to be dangerous. And likewise, in a similar fashion, the saline implants are equally culprit in the breast implant illness. So hopefully that helps understand the nature of the reaction that the breast implant illness causes. Please do ask me any questions that you may have at the comments section. I'll be more than happy to answer as we move along. So one of the other questions that I was asked was, what can I do to prepare for what are one of the other few things that I can do in order to prepare for the surgery? The most important thing is, I tell almost all the patients in my consultations that, you have to be a informed patient. As part of the informed consent, you have to do your homework, and you'll be surprised how many patients that I see that I ask, have you gone to my website? Have you gone to my YouTube videos? Have you looked at and looked into as to why, how I do the surgery versus other surgeons, other docs who proceed with the explantation, and then when it's time to dissect off of the chest wall, they basically cauterize and leave the silicone behind, which I find is an incomplete surgery, because the burden is left behind, and that small amount of silica which is within the capsule itself will continue to mount the immune response, and it will continue to trigger the breast implant illness sign symptoms, and the patient will be left with a disservice. Now, what essentially happens is, when you go to a explant specialist, I always mention that you have to write down the questions. You have to understand what, and essentially the gist of the conversation revolves around the fact that the entire capsule is and needs to be removed, and that the doctor must be determined, fixated into removing the entire capsule along with the implant as what I would call the gold standard and block. One of the patients asked me today what's the difference between a total capsulectomy versus a end block. End block resection basically means that the entire implant and the capsule basically is removed as one system, and that once the patient has left the operating room, the capsule is cut out and sent to pathology. Total capsulectomy means that the entire capsule is removed in its entirety, 100%, which is the word total. Capsulectomy meaning the capsule, ectomy means removal, which may happen where the implant is removed and then the doctor, the surgeon goes in and removes the remaining part off of the chest wall. Now I'm going to go ahead and look at some of the text that I just got, so I'm going to put you on hold. I have a few of my, we tried to connect earlier with one of my guest patients, but for some reason we were having technical difficulties, so I'm going to go ahead and see if I can connect or not. I'm going to put you on hold for maybe 10-15 seconds. Sorry. So I just was checking to see the remarks. I had received a few texts and someone was trying to alert me. So one question that I see, mammograms prior to explant and post explant. So that's a very good question. So 1 out of 8 or 9 women are going to get breast cancer. So statistically, if I don't screen the patients, and let's say there are some patients that have walked in and they have said, I've never gotten a mammogram, or I'm afraid if I get a mammogram, they're going to rupture the implant. I always want to make sure that there is no, I've done the appropriate screening to make sure that there is no signs, symptoms of any malignancy. Like today, for example, a patient came in, her father, a male father, actually had breast cancer. And there was also a strong family history of breast cancer. So what I did was I said, and the lady, it had been, I just wanted to make sure, and there was also a question on the exam. I was not able to feel the implant, so I requested that we need to get an MRI. The patient already had a mammogram which did not show the implants, interestingly, and we knew from the previous initial set of mammograms that the patient had where the implant was visible. So to answer the question, mammograms are a very effective imaging modality which has picked up a lot of breast cancer, and it is a very good screening tool, very effective, and there are modified views that can be done that do not necessarily apply pressure on the implant, so that we can screen these patients so that when I do operate on them, I don't find or run into masses. And if I do, absolutely 100%, I send them out to pathology because I do not want to miss any breast cancer. So statistically, if I take care of 100 patients in my operating room, you can only imagine that 12 of these patients statistically will have had breast cancer if I had not screened them. This is the prevalence of the breast cancer that we know of. Mammograms are very important. Now, what's the most important and the most commonly used, or the most common way that women find out that they have breast cancer is when they do a self-breast exam, and the one time per month in their, where they palpate and if they look for masses. And that's the most common way that breast cancer is picked up, and that alerts them to go to their primary care that basically most likely ends up getting a mammogram or an ultrasound and maybe even an MRI, and then ultimately a biopsy that proves. So mammograms are definitely important. There's a lot of discussion in literature that they are bad or they don't cause, they cause a lot of bad, especially when the patients have implants, they cause rupture. Surely there's a lot of pressure, but you can definitely request your primary care doc. And believe it or not, many family medicine, internal medicine doctors do not know that there are modified views that can be obtained by the same mammographer, radiation technologist, who can get these views so that there is no pressure applied to the implants when the mammogram is done. Normally, I wait for the swelling to come down. Maybe 3 to 4, 5 months, 6 months before you get a follow-up mammogram, so that you can compare the before and after. And certainly the mammogram after will be a very good one, for there will be no foreign body that will be obscuring the rest of the breast parenchyma, and the radiologist will be able to better decipher if there's any abnormal calcifications that may warrant a biopsy. Okay, so what I'm going to do is I'm going to go ahead and see if I can get, I have Alicia here, so she's telling me that there is a link, and I'm going to see if I can connect